Hello and welcome to the BSAVA Science webinar, taking a closer look at some of the papers published in the Journal of Small Animal Practice. I'm Luisa Dormer, Scientific Editor at the BSAVA, and today I'm joined by Nicola Di Girolamo, Abbe Crawford and Tom Cardy to discuss the paper, Is there a link between bacteriuria and a reversible encephalopathy in dogs and cats? Nicola is an Associate Professor in the Department of Veterinary Clinical Sciences at Oklahoma State University and is the Editor-in-Chief of the Journal of Small Animal Practice. Abbe is a clinician in neurology and neurosurgery with a postdoctoral research position at the Royal Veterinary College in the UK. In 2018, Abbe obtained the Diploma of the European College of Veterinary Neurology. Tom is the co-clinical director at Cave Veterinary Specialists in the UK and is also an EBVS European Specialist and RCVS Specialist in veterinary neurology. Welcome to all of you.
Hey there.
Thank you. Hey. So as I understand it, there is a growing body of clinical data supporting an association between bacteriuria and neurological dysfunction in human medical literature, but there are no reports documenting such an association in veterinary literature. With that in mind, could you tell us a little bit more about the rationale for this study, please?
Shall I start us? Yeah, so I guess realistically, it was almost a clinical hunch of ours, or a clinical suspicion that drove this initially. And well, for me, the first case that I had where I had a clinical suspicion of this really challenged me, and I spent a long time looking for reasons as to why this cat was so neurologically abnormal. And after many £1,000s worth of investigations, the only positive result I had was a urine culture. And prior to that, I wouldn't have even really had this on my radar. And it was only with the help of the internal medicine team and a lot of work that this became of interest, and that case really drove it for me. And I think Tom was in a similar position, if I can speak for you, Tom, in that he had also seen cases where really our investigations were otherwise fruitless, and we were left with just a diagnosis of a UTI. And so we were then quite interested to start to think about, is this a thing clinically? How often do we see it? Do we really buy it? And what's out there in the human medical literature? And so really this study is more just a very preliminary exploration of whether we should be considering subclinical or clinical bacteriuria as a cause of neurological deficits in veterinary medicine.
Great, thanks. Tom, do you have anything to add, or you have?
Yeah, I mean, mine was driven similarly to Abbe, but also from a slightly different direction, in that quite often I would watch those late night hospital programs, 24 hours in A&E and things like that. And very often, if there were geriatric patients in there, one of the first things they were always doing was screening for urinary tract infections. And just a brief delve in the literature shows you that any of these patients with sort of delirium or confusion, somewhere depending on which literature you look at, about 10 to 50% of them will have a urinary tract infection. And it's exactly as Abbe says, is this causative? Is this incidental? So it seemed worth investigating at the time.
Yeah, absolutely. I think we've probably all had relatives, for example, that have been in very similar positions, elderly relatives. So could you outline what you did and what you found for us, please?
Yeah, I can have a crack at that, Abbe. So Abbe and I guess, are kind of reluctant to describe it as a study. It was almost sort of a speculative delve back into the case records that we had at the RVC. So we retrospectively looked at the case records from, 2017. We looked in the database for dogs or cats with acute onset neurological signs that had a predominantly forebrain localization. The inclusion criteria were that they had to have had positive urine culture and an MRI and a CSF analysis to exclude structural brain disease. So we're trying to narrow it down to a population where we felt we had a good chance of seeing if the UTI and the neurological changes were associated. We found a decent number of cases, but once some were excluded due to incomplete records or evidence of possible structural brain disease, we were left with a really small population of 7 dogs and 4 cats. Within that study population, which presented acutely, we found that the neurological deficits, though, improved really, really quickly, sort of 1 to 3 days, with initiation of antibiosis and fluid therapy, and anti-seizure medications if they were required. So it's far from conclusive, and we would never be as bold as to say that there's a cause and effect here, absolutely not. But what it did do is hopefully open up the discussion that bacteruria could perhaps lead to a reversible encephalopathy, which supported some of the literature that we'd seen in the human field.
Well, so in your study, only 2 of the 11 cases were considered to have clinical bacteriuria. What do you think these findings how these findings are going to impact clinical practice? So do you think that bacteriuria should be considered a differential diagnosis for patients presenting with mentation changes, but with an absence of clinical signs of lower urinary tract disease right now? Or what are your indications for that?
Yeah, I guess that's a really pivotal point in the study, isn't it? So we really recognise that actually very, very few, the absolute majority of our patients did not show clinical signs consistent with a clinical UTI. The minority showed consistent clinical signs. And so realistically, as a clinician, this is not going to be top of your list of differentials for a case presenting to you with acute onset neurological signs. And I guess the whole goal and hope from this is maybe just to flag up, while we don't think this is common and while we don't think it's ever going to be top of your differentials, it does affect some cases in our experience. And perhaps it's just a really nice thing to start to have on your radar. It's something that would be very simple to rule out, very cost effective to rule out, and may start to give really important clinical information. But I think, like you say, the finding that actually some of these dogs have no clinical bacteriuria is really interesting and feeds into actually some of the debate in the human literature, because generally speaking, if you're subclinical, you don't receive antibiotic therapy, whereas if you are clinical for your UTI, you do. But I guess we're starting to think, well, if we believe that there are other associated clinical signs, that is a reason to treat, even if they don't show dysuria, hematuria, stranuria, plaquuria. So I think this is just an interesting debate and something to start thinking about and looking into a little bit more.
In the human literature, the characterization of a clinical bacteria is really poor. In some studies, it's just based on patient questionnaires. In others, it's on clinical signs such as dysuria, polyacuria, a pyrexia. And there's only one real study where they actually set a quantitative level, so a set number of bacterial colony forming units in that cystocentesis for study inclusion. Conversely, there were also a number of sort of patients who were felt to be subclinical, and they also had a positive culture and responded to antibiosis. So there's obviously a broad spectrum of potential sort of effects of these urinary tract infections. And as Abbe says, it's not the first thing you're going to consider on your differential diagnosis list, but in many cases, if you're presented with a sick cat or a sick dog, you're going to do a urine culture and sensitivity and a urinalysis as part of your minimum database. So if we can sort of bring this into the discussion as a potential differential diagnosis, that hopefully should be useful.
Thank you. So I think all dogs and cats included in your case series underwent MRI of the head. Were the diagnostic imaging findings lifted directly from the clinical records, or did you have someone review the images to try to avoid inter-observer variability?
Yeah, that was a real key inclusion criteria for us, is that we wanted to guarantee that all cases that we included, we were as confident as we could be that we were not missing significant structural intracranial pathology. So we did go back and look at the images again to make sure, was there something subjectively abnormal or anything that maybe could be contributing to these animals' seizures or other abnormal neurological signs. Yeah, that was a really important part. And actually that was the reason our numbers kept dwindling. We started off with a lot more and had to keep whittling down because we were so, we wanted to be really confident that we were not missing other pathology that could explain the signs.
Great, thank you.
Yeah, because we had 4 times as many cases, didn't we? 4 times as many dogs and cats, and by the end of these persistent exclusions, we were left with this small number.
Yeah.
Yeah, that makes sense. So none of the dogs in your case series had plasma ammonia concentration measured. Is this something that you think is going to be useful to investigate in future research? I noticed that 3 cats did have plasma ammonia concentration measured, and 2 of them had elevation of ammonium concentration. So what do you think about that?
I can do a bit, Abby. I'm not sure this is my area of speciality, but I can do a bit. So this is absolutely a weakness of the study. It's probably the key weakness and the key thing that if we were doing prospective research, we would change. I mean, measuring ammonia it's a highly labile compound, and it's actually quite difficult to measure accurately at a point of care, and it's highly dependent on how it's processed and sampled. In a prospective study, we would make sure that all animals had ammonia leveled at the time of entry into the hospital with a standardized procedure. I guess the rationale being, exactly as you're alluding to, is that elevated levels of ammonia are thought to lead to these neurological signs. In most cases, historically, they've been shown to be produced by sort of urease-producing bacteria, and that's one of the underlying mechanisms for these changes. Abby sent me a really interesting paper, I think, a few days ago when we were preparing this, that shows that also some non-urease producing bacteria may have that ability to change the way that ammonia is produced and metabolized. So it's likely that these are sort of forming part of the underlying mechanism of these neurological changes. It's interesting, though, that elevated ammonia was only found in 10% of human patients. They measure it much more routinely and thoroughly, and in those patients with UTI and delirium, it was much less frequently elevated. So I'm not sure how that fits into our sort of case study, but it clearly, and Abby's always really keen to emphasize, it's not probably the only mechanism that leads to these neurological deficits, and I think Abby's probably better informed to talk about the other ones, I hope.
Sadly, probably not, but I guess we are starting to be aware that cases presenting with a hepatic encephalopathy are probably very multifactorial, and while elevated ammonia is certainly a major player, there is a growing recognition of multiple other factors that feed into that, and I'm sure some of those apply in the situation of a bacteriuria case. I think particularly interesting is the role of inflammation, and we talk about that very briefly in the paper in our discussion section, but actually it's starting to be recognized that systemic inflammation and elevation of cytokines are going to have effects on your central nervous system, things like alteration of blood-brain barrier permeability, change in GABA receptor expression. All these different things are going to feed in at different levels of brain function, being disrupted in a multifactorial way, and it's almost like a soup, I guess, contributing, and we're only just really scratching the surface of why that happens and what are the different ways that we can intervene. And I think it's really interesting and very much something that is being developed and studied in the human medical literature, and hopefully we will follow suit in veterinary medicine.
Thank you. Yeah, something definitely interesting to know more about. So in terms of treatment of these cases, of course, since this is quite a case series that went for quite a long time, the treatment was not standardized, and I've noticed that some of the treatment included intravenous fluid therapy, antibiotics, anticonvulsant medication, and of course, due to the design of the study, it's impossible to say which treatment was the most effective or effective at all. So I would say my question is, there has been any studies in the human field that have looked into this? What is the best treatment for this potential problem, and try to find out what are potentially association or confounders that may, hinder the treatment of this condition?
Do you want me to go, Abby, or you go?
Don't mind.
I'll go.
Okay.
It's difficult, isn't it? Because these cats and dogs, when they present, very often because of the neurological deficits over those 1 to sort of 3 days, they haven't sort of been maintaining homeostasis. They perhaps haven't been eating, they haven't been drinking properly, they've not been grooming, urinating, and looking after themselves. So, I mean, I think Abby and I both think that the intravenous fluid therapy undoubtedly will make some contribution. It's rehydrating the animal, it's improving perfusion, it's potentially diuresing out some of these neurotoxic compounds, and it's generally getting them back on their feet again. The antibiosis as well, we gave that to all patients, or that was given to all patients, and you can't differentiate the two. We hope that the antibiosis is contributing to getting rid of that bacteria, taking away some inflammatory mediators, perhaps taking away some ammonia. So the two of them are working synergistically to improve their function. But from this size population, it's impossible to say which is the most influential in getting these cats and dogs back to normal and back on their feet.
Absolutely. So I suppose thinking about the human literature again, in human medicine, we've already mentioned that geriatric patients tend to be overrepresented. I wondered whether you identified any potential risk factors for veterinary patients in this case series that you think warrant further investigation?
Yeah, I think that's a really interesting point, and we almost went in expecting to find a geriatric predisposition in our cases too, and that wasn't the case at all. Actually, a lot of them were middle-aged adults, and so again, limitations of a small case series, we weren't really able to pick out definitive predisposing factors, and I think that's definitely something we'd really like to do in a larger scale prospective study. It's really interesting when you start to tease out the human medical literature, what's recognised. Absolutely, it's classically the geriatric patients, very rarely children, but there is some association with febrile seizures. But what's really interesting when you start to look in the geriatric population is it's not just their age that they bring, it's often a plethora of concurrent conditions. Really interestingly, there's a definite association with urinary incontinence, but also urine retention, estrogen deficiency. So some of those things would certainly be interesting and very feasible in our population that were largely neutered, whether there's hormonal influences there. There was one case that was polydipsic with a component of urinary incontinence. So, I'm sure that there was some similarities and overlap. It's just we weren't able to convincingly tease those out in our limited numbers.
It's far more, what's the word, logical in the human population, as Abby says. If you've got humans with dementia, rheumatoid disease, incontinence, vertebral fractures, and osteoporosis, these guys aren't hydrating, they're not bathing properly, clothes aren't being washed. It's far easier to see how a proportion of those could develop urinary tract infections. It's much more difficult to make those associations and inferences from just the little 7 dogs and 4 cats that we've got. So it's certainly something we'd love, maybe not us, but someone to look into.
Great. Well, thank you all so much for giving up your time today. It's been a really interesting discussion, and thank you for listening. As a reminder, the full version of this paper can be found in the August 2020 issue of the Journal of Small Animal Practice. A link can be found in the comments below the recording. Join us next time when we will be discussing the papers RHDV2 Epidemic in UK Pet Rabbits, Part 1, Clinical Features, Gross Postmortem and Histopathological Findings, and Part 2, PCR Results and Correlation with Vaccination Status.